Hey everybody, this is Dr. Nick with the Springfield Wellness Center, Springfield's #1 natural health care providers. Today we're going to be talking about runner's knee, which is a common problem obviously with runners. So it is, the technical term is the patellofemoral pain syndrome. And the reason why is because it is pain where the patella lays onto the femur, which is the thigh bone. One of the biggest causes of that is muscle imbalance between the front and the back of the leg. So a lot of people that have tight hamstrings, which is most people, and tight calves will put pressure on the knee, pulling back on it. And then if you have a weak quadricep, it won't allow the patella to track the way it's supposed to, and it can start to create irritation. So the pain that you'll be feeling if you do have runner's knee can be right behind the patella or right at the top. It can be dull and achy, but it can also be sharp and sudden. So there's a lot of different ways that it can present. But basically, if you've been running a lot more, if you've been trying to increase your miles, if you're training for a half marathon or a marathon, it may be a problem that you're dealing with. So what can you do once it starts? So once you start to feel pain in the knee, the best thing you can do is start to ramp back on the miles. You want to take as much pressure off of the knee as possible, especially if you're going to continue running. Soft surfaces are another thing that are going to be really important to make sure you do, as well as checking on your footwear. So runners that are going to be running more than just a casual run every weekend or so, you're going to need to make sure that you've got a good running shoe that is fit to your gait and your foot specifically. So what we're going to be doing today is we're going to be talking about what can we do in the office to help with that. So obviously we talked about the muscles. Those are probably the most important things when it comes to runner's knee. So first I'm going to show you a couple stretches that can be done to help stretch out the hamstring, and then I'll show you a stretch that you can do to stretch out the calf, and then we'll use our little sharp teeth tool here to work on some of the musculature on Kayla's leg. So what we're going to do first is we're going to show a hamstring stretch. So the easiest way to do it if you're by yourself is you can get a towel, or if you have a stretching strap, you can put this around your ankle and you can pull your foot back on it. You want to hold it tight and then push against the strap or the towel for about 3 seconds, and then pull a little bit further, and that'll help stretch that out pretty good. If you have a partner, you'll just have the person put their foot onto your shoulder, and then you're going to push back till you get to about a stopping point, and then I'm going to have Kayla push against my shoulder with her leg, and relax, and then go a little bit further, and same thing, do that again, relax, a little bit further, and again, and relax. And you can do that about 3 to 5 passes, and do it on both legs, because usually when one hamstring is tight, the other one is as well. For the calf, I'm going to have you stand up for me. And so find something that's probably about this height here. You're just going to put your foot up onto it, and you're going to lean forward. So go ahead and do that for me. Make sure that doesn't roll out underneath you. So when you lean forward, you want to make sure that you feel the stretch right here on the gastroc, so the biggest part of the calf. And you can lean forward as much as you need to, or as little, depending on how tight it is. Okay, so go ahead and have a seat again. Now with the quadricep strengthening, it's especially important for women because they have wider hips than males do. So it's called a Q angle, the angle that your femur comes into your knee. So that'll put more stress on the knee itself. That's why a lot of female athletes tear their ACLs because of that increased ankle. So the patella has a chance to irritate more because of that. So as a woman, if you're going to be running, make sure that you're doing exercises to help strengthen out your quads. Leg extensions are a good one that really isolate that quadricep muscle. So what we do for any type of adhesions that might be going on in the muscle is we use our little sharp teeth tool here to help break up any scar tissue, adhesions, and try to get the muscle to lie back down. Whenever you have a muscle that tears or gets strained, the fibers need to lay down this way. When it strains, they tend to fray like that, and the muscle fibers are sticky themselves, so if they don't get laid back down correctly, if they stay like this, wherever they touch, will start to create adhesions, which leads into muscle scar tissue. So what we're going to do with the tool is we're going to be working anywhere around the knee, and when we scrape across the muscle, it'll feel like almost like a grittiness or a sand underneath the tool, and that'll show us where the adhesions or the problems are at. So we just work there into, and obviously we'd be doing this skin on skin. Kayla has a hole in her sock today, so she can't take her boot off today. So we are going to be working on the muscle to make sure that that's all worked out and any inflammation that's built up gets removed. So another thing, inflammation is really the biggest thing when we're talking about runner's knee, and you've probably seen on some other videos that we've done where we actually use our deep tissue laser to help the healing process and help to decrease the inflammation a little bit faster than, say, just ice or rest. So that laser is really good because it uses a light to actually get down to the cellular level so that it increases that healing process a lot faster. So the big things that you can do to help heal on your own, make sure that you're stretching out your hamstrings and your calves, strengthen up those quadriceps, make sure you avoid running for a little while once you start to feel the pain, especially downhill running, and start to run on some softer surfaces like grass. Here in the office, the things that we're really going to be focusing on is making sure that the muscles are working the way that they're supposed to, and treating it with some laser. We also have an anti-gravity treadmill, so if you are wanting to continue to run, but you don't want to put the wear and tear on your knee, that's a great option for you. You can take away up to 80% of your body weight while you run, and so if you have any questions about that, you can visit us over at recoverspringfield.com, and it's got a lot of information over there about the anti-gravity treadmill. So if you have any questions about runner's knee, leave a comment below. If you know somebody that's dealing with this, make sure you like or share it. And if you have any questions, visit us over at wellnessspringfield.com or call us at 726-0422. We'll see you next week.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.